Hey guys, Aaron here, physical therapist, orthopedic manual physical therapist. Today I have my friend Dr. Albert Einstein with me, and he's going to be my model to demonstrate special testing of the cervical spine, ligamentous testing in particular, and the transverse ligament in specific. Now, this is a test that should be performed on all of our neck patients who come in the clinic complaining of headache, neck pain, especially in the presence of trauma or no imaging that is being performed. That being said, as you go through your assessment, just please be mindful of ruling out your D's and really paying attention to your Canadian C-spine rules in order to rule out immediate referral out for imaging. So let's say you've gone through all your objective and measure or objective, subjective questioning, and you're now going to start your objective measurement testing and observation. This is a test you want to do before you even put your hands on a patient to check even active range of motion, because end range stuff can create some cardinal signs and symptoms, that meaning the 5Ds or some nausea or vertigo or that kind of thing, nystagmus, that can all be brought about for instability issues at the upper cervical spine, in particular transverse ligament. So just to describe to y'all, transverse ligament, the ligament sits on the anterior aspect of C1, and what it does is it envelops the dens of C2. So this is a ligament that kind of sits around, it hooks around that dens, okay? And what it's supposed to do is prevent the dens from translating posterior into the spinal cord. This is often, I don't know if a little tidbit of information, but this is often what happens when, or what used to happen when people used to have a noose, that knot that they tied in the back of the rope, that would actually force and break through the transverse ligament, forcing the dens into the spinal cord and causing, life to exist and perishment of that individual who would to be hanged. So just some historical information on the presence and the importance of that ligamentous structure. Now, it's a super strong structure, but in a lot of patient populations, it can be lax, loose, or create some of these interesting symptoms that patients get. And the populations that fit for laxity, the EDS patients, those who have any type of chromosomal imbalances, Down syndrome, things like that, they inherently have some upper cervical instability in that ligament. So when you're testing, one of the ways I like to do it, and we've all done sharp purser, but this is a little more specific way, in my opinion, to test for instability. So what you want to do is, if Albert Einstein is here, you want to have your pad of your finger on C1. So then as you come around the patient, your deltopectoral groove is sitting on their forehead, and you kind of take your other hand and support the occiput. And what you're going to do is do a little compression and then just lift. And what you should feel is that you're not changing the bottom hand position. That maintains, and you should feel C1 lift right up of your hand, because if that ligament is intact, it will pull it up, which means that everything is normal. Now, in a person who has laxity, you might lift and you may still feel that same pressure on your hand. This may be an indication, especially in the presence of trauma, that someone has some laxity of the transverse ligament, especially if when you get them into that position, they get those cardinal signs and symptoms. And those indications, be mindful of the patient, let them know, educate them on what you're finding, and then also make sure to get in touch with their physician, and also educate the patient that they might want to get some open mouth x-rays or some MRI imaging, just to make sure there's no space between the dens and C1. There's a certain amount of millimeters that are allowable, letting the physician know that the transverse ligament is intact versus not. And getting the CT or MRI of the neck will surely tell us if that ligament is intact. So give it a try. All your neck patients, just the more you try, the more you feel, the more you feel, the more you learn and know. So that's how we grow and be better at the small things. And this is a start. So more tests to come, but let's start with transverse. Go practice.